Hi, thanks so much for tuning in to Mom Boss Chronicles. My name is Jen.
This is Sue.
And this is Danielle.
We are three moms that work together in real estate and are good friends, and here to talk to you about fun topics, the good, the bad, the ugly of mom struggles, real estate, and other fun stuff. So make sure to subscribe to listen to more.
Hello, everyone. Welcome back to Mom Boss Chronicles. Today we have such a special guest, Joanne Chang. Hi. How are you?
I have like major imposter syndrome.
And you're a doctor.
Joanne is a doctor.
I didn't know doctors can get that.
Oh, I think.
Is that a sickness?
I think, well, let's see. We're all slightly type A overachieving women in this room, right?
I don't know what you're talking about.
Don't we all?
Are you B plus now?
Don't we all have a little imposter syndrome?
Totally. A whole episode.
Yeah, I didn't listen to that one yet.
Okay,
It's in my queue.
We'll send it to you.
Yeah. Well, you should not have that. She is board certified OB-GYN, mother of two. Did I get that all right?
Yes.
Delivering babies, taking care of women.
Trying.
Yeah, I'm sure the system probably makes that hard for you, which we'll chat about. But so excited to have you in.
Thanks.
How did you decide you wanted to be a doctor?
I really wanted to help people. No, I didn't know. I didn't know until I was like a junior in college, which I think is a little bit late for most people who go to medical school, although I think the landscape is changing there. But my dad was a doctor. He was an anesthesiologist. He worked at Bayshore Hospital just down the street for he was there for 30 years, from 1977 to 2007. And, watching him, I knew it was a tough life. He was always on call. He'd be working long hours. And I was like, I don't know if I want to do that. And then
Did he encourage you?
He didn't really. He was like, just do what makes you happy, And I went through college and I was a chemistry major. And I was like, I'm going to be a chemistry professor. And I'm going to like work at Merck or something. and then I just didn't love it.
But you like science?
I love science.
Yeah.
I love science. But then when I did internships and I was working in a lab, like behind a bench with like test tubes. And
You're like, I don't want this life.
I don't want this life.
Yeah.
So that's when I like really looked at what I wanted to do. And I honestly really just wanted to help people.
That's awesome.
So sweet.
So then I was like, well, what's the best way? Like, who set the best example in my life on like how to help people? And I was like, my dad. So I went to medical school. Just like that.
You're right.
Easy.
That's awesome.
Have you ever told your dad that, by the way?
Yeah.
Okay.
Yeah.
Oh, that's so sweet.
Yeah, that is really sweet. Did you kind of go into it knowing you wanted to get into women's health, or that came later?
That came later. So I went in thinking I wanted to do like primary care, like be that general practitioner that sees the whole family.
Yeah.
And then, so your first 2 years of medical school, at least when I went to medical school way back in the day, are just like in the classroom. You're sitting in a lecture hall in front of a guy droning on about embryology and anatomy and immunology. And then your third year is when you actually go and do clinical rotations. Okay. So then you do a little bit of surgery, you do a little bit of internal medicine.
Exposed to everything.
Mm-hmm.
Wow.
And when I got to my OB-GYN rotation, I was like,
that clicked.
this is where I belong. Yeah. So, and then from then on, I was hooked. I was like, I can't do anything else.
That's amazing. So you were, correct me if I'm wrong, a partner in a practice. For how long were you doing that for?
I was there for almost 9 years.
Wow.
I think, if I get my dates right. I joined in 2014, and then I just recently left them. So
okay, so that must have been
tough.
Yeah, always.
Was it a lot of hours?
So it's a ton of hours being an OB-GYN because it's a 24/7 job.
Right.
Babies don't come when you tell them. I mean, we've all experienced that being pregnant ourselves. Like, come on. So it was juggling being the doctor in the office, doing, annuals, preventative care. It was juggling being the surgeon, doing hysterectomies, ovarian cysts, all that. And then also being the obstetrician, like being with you during your labor. So
that's a lot.
It takes a lot of time.
Yeah.
And one of the challenges being a mother is that, like, my own kid is sick.
Right.
You can't call out.
If I cancel a day of office hours, that's 25 to 30 people who have to reschedule or get fit in somewhere. I was not immune to the fact that, like, when you come and make an appointment with me, you've also rearranged your schedule. Yes. You've taken a day off from work or half a day, and you've arranged childcare, and all of a sudden your doctor's like, sorry,
Not
can't
today.
make it.
Yeah, that's tough.
So and then it adds a lot to the guilt. Like I'm letting my patients down.
Oh.
And then I'm thinking about them while I'm home with my kids. So I'm letting my kids down because I'm not fully present. And so it gets to be a challenge.
I can imagine.
I'm sure that's really taxing, like on your mental and emotional.
Yeah.
Yeah.
I hope my patients realized or recognized how much I actually like took home with me. And I don't mean that in a bad way.
Yeah.
But like I really truly loved and cared for my patients, and I would like go home and I'd think about them and I'd be like, oh, I hope she's doing okay. Or like, I hope, like I hope I don't get a call from her next week because that means she's doing better.
Right.
you
That's
know?
an awesome doctor.
Yeah, because I don't think a lot of doctors have that.
Compassion.
Empathy.
Yeah. That's a really
Sure.
I hope that's a wrong statement. I
No. Well, I guess.
Or you don't realize, which is nice to know
Yeah,
that
maybe you
doctors
just don't realize. Right?
think about their patients and their best, well-being.
Well, I
That's
think
awesome.
we only probably hear about the bad, like the negative
Right.
stories where perhaps,
yeah.
but they're not as caring and empathetic. But I think generally speaking,
Generally speaking,
right?
like when
Why
I-
do you even get into the profession? Because you care.
Right.
I mean, when I talk to my colleagues or like when I interact with other doctors or like when I'm just listening in the doctor's lounge, like there's always doctors that are just like, oh, hey, that patient that I sent you, like, did she do okay? Or like, oh, did you get those results I sent you? Like, did you follow up with that? Like, so we're always checking, like, we care.
That's
Yeah.
awesome.
I don't think anybody goes into medicine now, especially now,
Right.
wanting to make a lot of money or doing it for money.
Right.
No, right.
Although money has worked its way into healthcare, and that's a whole other story. But I think we all genuinely go in with like a heart for service, like to take care of people and what avenues that takes us down. Like some people really like surgery and want to do that, and some people really want to do ER and do that. And then there's those angels who want to do primary care and take care of people from head to toe.
Yeah, it's a lot.
That's a lot.
I'm sure. Yeah. I was going to say that you mentioned when I think OB-GYN, obviously the first thing I think is you're delivering babies. Oh, that must be so hard 24/7. You have to be on call, whatever, your on call days are. But also, now that you mention, you're doing hysterectomies. You're doing the
I was not thinking about that. Right. Like I forget that there's so much more.
so
women's
much
health,
more
yes.
that goes into You just automatically think babies, and
Right.
there's so much more on your plate, and so much that these women are going through, and you have probably such stress. Like you're the one who's. I mean, I can't imagine carrying that. That's pretty incredible.
It's a privilege to be part of a woman's life during like the really formative years of their lives. And, being in a practice for so long, there were a lot of patients when I first met them, they were just dating.
Oh,
And then a couple of years later, they'd come in and they'd be like,
oh, that's so cool. Yeah.
did you notice something? And then, we go through wedding planning and everything. And then like after the wedding happens and we talk about the honeymoon, then it's like, all right, like I'm ready to get pregnant. And so there's somebody, I've taken care of a lot of patients where like I went from them dating to now they have like 2 or 3 kids.
That's really cool.
That's so sweet.
But and it's
the
it's really-
evolution.
and it's in your own lives. Those are like really important formative years of your life. Like when you move from your different stages, like single lady, married lady, mother.
Right.
Yikes.
Yeah.
And then even through that, I had a lot of patients who were older than me who were like then transitioning into menopause. And like, am I still a woman if I don't have a period? Like, I'm getting chin hair.
We were just talking about that the other day. The hairs, the rogue hairs.
Do you know what I think is so awesome for you as a doctor, like to have that comfort level with your patients? Because when you are a woman going through everything, when you having a baby or the menopause, it's such a vulnerable place to be in, and you're kind of afraid to open up to your doctors. So for you to have that compassion, do you feel like your patients were pretty open with you and easy for them to talk to you about things?
I think a lot of my patients were pregnant with me. Like I was pregnant at the same time.
So they got to see you be human.
Right. Yeah. So like I'd walk in and they would know I did not have a good night. And they'd be like, oh, we've been there. So like they empathized with me, I empathized with them, and it was great. It was just this great relationship. Like
That's
we were going through it together.
Yeah.
Supporting women.
Yeah.
Yes.
My first OB was a man, and it was just who my mom used, and I just felt so uncomfortable from the get-go. And thinking back, I'm like, it's great and noble and whatever, but you will never understand what I'm going through. You just won't. And I can't. And again, that's not to say men shouldn't do it, but me personally, I feel like I need that relatable thread, you know, with a
To
woman.
be open.
Yeah.
Share the same sentiments with you. I think I went
Exactly.
one time because maybe my doctor in the practice wasn't there, and I was like, this does not feel
Right.
and my brain. And I'm sorry, man. No offense,
Yeah.
but I don't know how you're going to tell me parts of womanhood when you aren't experiencing them
Right.
yourself. You know.
Yeah.
It's weird.
Well, I had a patient ask me, she was like, how do I know if my water's broken? Like, will I be able to tell? And I was like, yeah, it kind of feels like you're peeing out of your vagina. Like, we all kind of know a little bit what that feels like, but like, I don't think a male physician would
Right.
Yeah. Or we've all had that sensation where we've been sitting and then we stand up and we feel that our period has started. That dread.
Yes.
And that like very visceral sensation.
Yeah.
Like,
You're like,
yeah. That's another indescribable. I mean, I say it and we all feel it. But if you haven't ever experienced it, like, how do you describe it to somebody?
Right.
Yeah, it's so true. And there's many amazing male OB-GYNs, but it's just a, personal preference, I guess, at the end of the day.
Yeah.
So now you're not working in
private
office.
practice.
Right, private practice. Thank you. So what are you doing now?
So I'm something called an OB hospitalist. So if you are ever wondering what happens when you get to the hospital and your doctor isn't there, a lot of hospitals now are moving to have this role in place called an OB hospitalist. So all I do is sit in the hospital. I do it for 24 hours at a time. I don't.
Oh, wow.
There's different models, but I choose the 24.
So a full day on.
Yeah, a full day on. And I'm there for emergencies. I'm there for like anything that comes in through the ER. I'm there if you're 9 centimeters and your doctor's driving frantically from the office.
Time is now. Yeah.
So that's what I'm there for. And there's different models all around the country for what this means. There are some places where really that's just your role. You're there for just the emergencies only. And then there are some places where the doctors who have their private practices are like, listen, I'm getting burnt out. Like, you're going to take my service. Like, you're going to deliver all my patients, like, on nights and weekends. Like, I'll be there during the day, but you'll be there at night.
Wow.
And so I think it's awesome for working moms.
Yeah.
On both sides, for the working mom who's in the office, who's like, oh, at 5 p.m., I know I can go home, get my kids, get dinner on the table, don't have to worry about anything. And then for me, I know exactly when I'm going to be gone from the house. So that way, when I don't have to worry about like running back and forth. Like I'm there in the hospital for 24 hours and then I go home and I usually have a couple days off before I have to go back and do it again.
Nice. That's
Do you
really
like that
great.
better?
I do.
That's awesome.
Yeah.
That's so nice.
And I think it's because more women are getting into medicine, like we want that. Oh, I hate to use this stupid work-life balance.
We debunked that. Yes, it's not. There's no such thing.
That's also on my queue to listen to. I'm sorry, I'm so behind on podcasts.
It's okay. You're a busy mom.
I was listening to audiobooks for a while on my commute, so
That's awesome.
I put all my podcasts on the back burner, and now I have to catch up on all those episodes.
That's right.
Did you get to pick who you wanted to deliver your children?
Yes, I did.
Yeah. Were you like hyper focused, critical, like, or were you trusted the person? You're like,
I trusted the person. Yeah. So it was another partner in my old practice. She's like my best friend.
Oh,
Cool.
She's like my other half. Like we're a little bit codependent on each other. So she, I used my practice, but I'm like, by the way, you're the one who's delivering my baby. Like I don't. That I didn't trust anybody else. I trusted everybody in my practice, but I was like, you
felt
one.
comfortable.
I have the most connection too. So
is it weird since you know so much as a doctor? Like when you were time for you to deliver, did you feel like you wanted control, or did you?
I kind of lost control a little bit. So I got induced. I was a gestational diabetic. It was recommended. I got to fully dilated. I pushed. Wow. Baby didn't come out.
Yeah.
And I like lost my mind a little bit. I was just, I looked at, we had a midwife in our practice. So she was pushing with me. And I looked at her and I was like, Barbara, is it going to happen? And she went, and I was like, I lost it. I knew it because she had that look on her face like,
I hate to give you the bad news.
Right.
Yeah.
And I like broke down crying. And I turned to my husband. I was like, so what do you think? Should I get a C-section? And he looks at me and goes, why are you asking me?
You're the doctor. Yeah.
You should know.
Like I lost my doctor brain for a second.
Kind of a good thing, maybe, right?
Right. But my husband was like, why are you asking me? I'm an architect. I don't do this for a living. So we went for the C-section. And the funny thing is I don't know if any of you've ever had.
I had C-section.
You had a C-section. You probably didn't know what was going on.
Well, I had a scheduled C-section,
Oh, okay.
so it was a very different scenario.
But, you know,
yes.
the curtain goes
like,
up.
Oh,
You
yes.
don't know what-
And you don't know.
No.
So, but the curtain goes up, and I'm listening to everything that they're saying, and I'm listening to the instruments and the, you know, the
And you know
Yes.
because you're a doctor.
right, the bovie-cautery. It makes that beeping noise, like beep.
I don't remember.
And I heard that a lot, and I just was like, "Oh, am I bleeding a lot?"
Wow.
My friend / doctor was like, "Can you please stop talking to try to forget that I'm operating on my partner and best friend?" I was like, "Oh my God, I felt so bad for putting her in that situation."
wild.
And then I made her do it again.
So it's interesting because I lost a lot of blood too. I didn't obviously know what was going on because I don't know. But I'm laying there and I'm like, everything feels really weird right now. Like more so, like I just felt like I was shutting down. It was weird. It was a very weird feeling, and my heart rate was going down. But interesting. But it happens a lot, right?
Yeah, it
yeah,
does,
it's common.
Yeah. But I was just listening to everything. I'm like, what are you guys doing? What part are you at right now?
Which step are we at?
Do they have to like take things out? I don't want to say like your
intestines?
organs.
Yeah.
So there is a technique in a C-section. It's called exteriorizing the uterus. It's just a fancy word for pulling the uterus up through the abdominal incision.
Okay.
Some people do it, some people don't. It's really for exposure, just being able to see the whole hole that you made in the uterus so you can sew it back up properly. I usually leave it in place though, because
Got it.
something weird about just yanking.
It's so I'm so interested in like if I could watch a surgery, I would love that.
So I don't know if I could, and was a question I wanted for you. Is that like getting into medicine? Was there ever a time, like doing surgery or blood? I mean, just you
Yeah, I
are
couldn't
looking at some
handle it.
very
Yeah.
interesting shit going on here. I would pass out.
Me too.
I probably would.
yeah.
Let's be honest.
In med school, there are the people who pass out.
Yeah.
And then
Okay.
they don't become surgeons.
Right?
Okay.
And you just know. That wasn't me.
You know, we had a good friend who, like, on the first day when we were practicing drawing blood on each other, he fainted. So
Oh.
he's a cardiologist now.
Yeah,
He's great at it. But yeah, so, it kind of weeds you find your niche.
Which is
right?
awesome because obviously you want people who are comfortable with that to do that
Yeah,
job.
right,
So
yeah,
it's,
yeah.
that's not what he was meant to do.
You don't
It's
want a
okay.
doctor
Yeah.
mid-surgery.
Yeah. It's really funny, like, looking back at, because, it's not like I'm really close with a lot of people I went to medical school with, but we're all Facebook friends. So, and you kind of are like, you became a neurosurgeon?
Wow. Yeah.
Or like,
That's not comforting.
no. I mean, he's great. He was very smart, but it's just like, you're a goofy
just say-
kid.
yeah.
Isn't that cool
I
how
went
people-
to med school
yeah.
with.
You're a person too.
Yeah.
And
right?
now you're like, you operate on
serious
people's
job, yeah.
spines and brains, and
Yeah.
it seems like you're very good at
That's-
it.
yeah.
Yeah, that's
Same with high
incredible.
school, right? When you think back, you're like, oh my gosh, you're an attorney or
Yeah,
like
right.
you're
Like,
corporate.
We're
Yeah.
grown-ups?
Yeah.
That's so funny. So I did want to bring up like the whole fourth trimester, topic and the sort of missed space of women's health. And it's like you have this baby and everything's about you and you're pregnant. Then the baby comes and the woman's kind of forgotten about.
Here's your baby.
Yes. Bye.
Good luck.
Good luck.
Yeah.
Yeah.
It is a missed space.
Yeah, it's very sad.
Why?
Yeah.
Right. Why? Why are we being cleared for exercise at 3 weeks now and postpartum instead of 6 weeks, which is still
seems so like
right.
yeah.
Like
Which I just recently listened to your episode with Holly and
Yes.
Kelly.
Yes.
The
Yeah, yeah.
doulas, which I loved, by the way. And I thought it was very interesting what they said about exercise
Yeah.
postpartum.
Running.
That could actually hurt your postpartum recovery. So
Yeah.
I was like, oh, that's interesting. So let me say.
I mean, again, they're not doctors, obviously.
No, but
I guess, medical training is it just focused more on like the pregnant women and then after there's not a lot of focus on like.
yeah, like I can't imagine exercise. I was still, bleeding at 3 weeks postpartum.
Or not even feeling
You're telling me
good.
I can go run,
Yeah.
and like crazy. It seems like I don't know.
yeah. So, yeah, our medical training is really like you said, it's just like the physiology of
Right.
pregnancy, getting through delivery,
Which is important.
which is very important, very important. But there's not a lot of emphasis on like how to holistically get you through that, like from delivery to becoming yourself again. It's
There should be like a postpartum doctor.
Care,
right?
right, yeah.
You're going to see this doctor for the next 6 months.
Yeah.
Like, once a week.
But, it's interesting. When I was in residency, I had a chief resident who would take the med students on this journey of the physiology of pregnancy. And he just described like everything that happens to our bodies during pregnancy. And if you just looked at it on paper and you didn't know that this person was pregnant, you'd be like, this person's really sick.
Oh, wow.
Like, do you see what's happened to her body? Like, and her vital signs
iron
and
levels, like,
everything.
all the-
Like, this person's really sick. And then you're like, no, they're just
That is wild.
Building a human.
building
their
a human.
bodies being depleted.
Yeah, the baby's sucking up everything.
And so it's amazing that there's not a lot of talk about like how to get from that alien sick person back to
Feeling great again.
the pre.
Yeah.
And we never fully become
Who we were.
Yeah.
who we were before because so much happened to our bodies. But yeah, there's not a ton of like, it's like, oh, okay, they have the baby and then you see them for a 6-week postpartum visit.
And that's it.
And then everything should be back to normal again, right? So there's not a lot of emphasis in that. When I went to medical school years ago, I don't know if things have changed in residency training and in medical education, but I hope so.
I hope so. I feel like it's become a more talked about topic, you know,
Yeah, less taboo.
postpartum and everything like that. So I would hope so.
But I also, not a lot of people know this about how OBs get paid. So this is like the dirty subject of medicine, right? Because we don't go into it to make money. And so we shouldn't talk about money. But if I don't make money, I can't keep a practice open.
Right.
I can't
Provide a service.
I can't provide a service. So OBs are paid a global fee for pregnancy, meaning from the first visit where you step into my office and I say, you're pregnant, to your postpartum visit, I get one flat fee from an
Really?
insurance company. Oh, yes.
Wow.
So if you're high risk and I'm seeing you every week to check your blood pressure, to check your blood sugars, whatever reason you're high risk because your baby's growth is lagging, if I see you 20 times in a pregnancy, I get the same amount of money from the insurance company as if I saw you, 8 times.
I didn't know
Wild.
that.
I didn't
Yeah.
know.
Yeah.
And that includes the postpartum visit.
Wow.
So,
And only one.
and only one.
Yeah.
So if I wanted to see you several times, that's fine, but it's all included in my global. And if I want to carve out space in my day to see you, to talk to you for half an hour about how are you feeling, how's your bleed, just check in on you, like, are you feeling okay? Are you staying hydrated? Are you seeing the lactation consultant? Are you bottle feeding your baby? How's the engorgement? Are you doing this?
Yeah.
All that's all unpaid work.
See, that feels to me just like another area where women's health and focus on women is like a fuck you.
Yep.
Right.
Mm-hmm.
Totally.
Yep.
I know, because right there, like, obviously, when we think about women who have to go back to work, there's no support even.
Right.
Like, we kind of are just focused on the pregnancy, but then after a baby, it's like you're on your own. You have to go back to
Right.
work. You don't get a medical
Right.
cover. Like, just bye.
And then you're expected to do this for free? No, you can't. It's
Right.
like, this is your job. You have a family too. You have to feed your family. You need
And
to
let's
get
be
paid.
honest, would you say a majority of OB-GYNs are female?
Now, yes.
Yes.
Yeah.
So, like, how long has that global fee been in place?
Oh, forever.
Yeah.
Oh, okay.
Yeah.
But it just feels to me like another opportunity to,
since insurance companies managed,
yeah,
all
like
of
that. Yeah.
Yeah.
Okay.
That's wild.
That's crazy.
Yeah.
That's
Yeah,
really
that-
crazy.
That needs to change.
You used to have to buy, pregnancy wasn't covered by a lot of
Of insurance, right?
commercial insurance policies. You'd have to buy a supplemental.
What?
Yeah.
Wow.
Yeah.
That's
And
crazy.
That's just recently been changed. So that
Insurance is crazy.
it's crazy.
Yeah.
Right? I don't understand putting profit into the equation of taking care of a person.
yeah.
Right.
Especially general necessity, having a baby, like, that's,
Right.
something that happens all the time.
But the whole way insurance works, like you buy car insurance and you hope you never get into an accident. You buy life insurance, you hope you don't die. You buy pet insurance, you hope your pet doesn't get sick.
Yeah.
You get health insurance,
and you have to use it, yeah.
but everybody's going to have to use it at
Right.
some point, unless you're really supremely lucky. But most
Yeah.
people use health insurance at some point in their lives. And the whole way that insurance companies make money is that they hope they don't have to pay for
Right.
something.
Yeah.
Yep.
So you pay your insurance premium for your car every month and you don't get into an accident. And so the insurance company's like, score, I made some money. But like, how do you, the disconnect in my brain, like how does
Right.
a health insurance company deny coverage for something so that, and,
Right.
and when they do, they make more money.
A necessity.
A necessity.
Yeah.
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 You
But
know?
do you think that was do you think being more involved and seeing that side of the medical industry also like was another kind of layer for you to like pull back in terms of, you know, not having the practice or is it like change your outlook, you know?
You feel like a hamster on a wheel.
Yeah.
Right?
Yeah.
Because, you know, our practice got bought out by a hospital and they make these like kind of benchmarks that you have to meet, productivity, and you're trying to reach for it, and you get there and they're like, great, do more.
Wow. Yeah.
Great, do more. Great, do more.
Or how are you putting a benchmark? You know,
It sounds like a corporate company, like with Macy's, right? Like, yeah.
It's the corporatization of medicine. But even before,
so gross.
even before we were bought out by the hospital, and there's pros and cons being
For
purchased
sure.
by a hospital.
Yes.
But so before we were purchased by a hospital, you know, we were getting reimbursed directly. So we'd have a contract with Blue Cross Blue Shield, and you know, we'd have one with United, and we'd have one with Aetna. And every year they'd be like, great, we paid you X amount of money for these services last year. We're going to have to decrease that by like 5% this year.
They would decrease.
Meanwhile, insurance prices are
Went
going
up.
through the roof.
And then, so we had Horizon, and they decreased how much money we were getting reimbursed. But then they increased our insurance premiums because we use them for our own health insurance.
And then this is why certain doctors' offices be like, we are no longer accepted.
Right.
Right.
Yeah.
Yeah.
Because it's not worth it for them.
And so you saw like an increase in like people who are going into concierge medicine, and they're just like, hey, you just pay me the money.
Yeah. I've seen
I'll
that.
do whatever I think you need to have done. But yeah.
That's interesting. I haven't heard of that.
Oh, yeah.
Huh.
I could never do that because I need that separation. Like,
Yeah.
The thing I like about my job now is I go for 24 hours, and then as soon as I sign out to the next doctor, and I'm like, hey, goodbye.
I'm going home. Yeah.
And you're not bringing it home with you for the most part.
For the most part.
Yeah,
I still-
not quite as much. I can tell you're a caring, empathetic person, so there's never going to be a.
But like, if I leave somebody at 8 centimeters, like a few hours later after I get home, I'll be like, did she deliver?
Yeah.
Everything
Oh,
okay?
that's nice.
Yeah.
Did
Yeah.
everything go okay?
Yeah.
I've heard a stat once, and I don't remember it exactly, but it was saying like America, for being such an advanced country, we do have issues with women, especially deliveries or pregnancies, like not getting the services or having like, I guess, medical downfalls. Do you feel like, have you heard anything about that, or do you feel like that is true? Or
I mean, I would love it if just more basic services were easier to access and covered, like a nutritionist or a dietitian.
Right. Oh,
during
yeah.
pregnancy. Even if you're not a gestational diabetic,
Yeah.
like, wouldn't it be great if there was somebody that you can go to that'd be like, hey, this is how you get better, you know, you're going to be iron depleted. So here are the iron-rich foods, and it's calcium's important.
That would be
magnesium's
amazing.
important.
Yeah.
You know, I know there's more and more lactation consultants and services available, but just more support.
Yeah. There's still not enough.
Or some physical therapy, like what Holly and Kelly were talking about, like pelvic floor PT.
That's who we have coming
we have a
on
pelvic floor person coming on after.
We should have just had you guys on.
I actually was thinking of that as I was driving here.
Wait, who we have?
Her name is Ashlyn Linehan.
Oh, I don't know her.
Yeah, her practice is Paragon.
Oh, I don't know.
She's in Robbinsville, you
Yeah.
said, right?
Oh,
So maybe
okay.
that's why
Yeah.
paths haven't crossed.
But that was so like after I had my son, not the 6 week, I forget. It was whatever after that, or maybe I made an appointment. I just felt like I still looked pregnant.
Well, yeah.
And, you know, I had, you know, the C-section and everything. And my OB, who I loved, left the practice. So then I was pushed off onto somebody else. And, you know, just like I felt like all the rapport, the history, everything.
Yeah.
I'm like, oh, starting all over. Now I'm having this issue. And to no fault of this doctor herself, I was like, I just feel like, you know, I still look pregnant and I feel like something's wrong. And she's like, well, you'll feel better when you lose weight. And that was it. And that was just kind of like a very disheartening thing to hear. And then some friends had mentioned, like, like pelvic floor. So then I had diastasis, so I worked on it, you know. But I never knew about that. But
yeah,
having that support,
Right.
if that was, if the availability of it, it would be nice if that was more available.
Yeah,
to
like
women.
if it were sort of like a one-stop shop. You have your OB, the same office. There's a lactation consultant. There's pelvic floor.
Nutrition.
Nutrition. All that would be so nice. But most of these things aren't even covered, right?
No.
Yep.
In a perfect world, if I designed prenatal care, if I just could start it all over again
You should.
in a private, I would.
I'll invest.
Yeah. I like this idea.
I would love it if, like, in my perfect practice, I would get every one of my patients who was due in the month of April, and I would have classes for them like once a month. And so like in the first trimester, we would be talking about nutrition and exercise and how to modify exercises for the rest of your pregnancy. And then in the second trimester, it would be, I don't know what it would be in the second trimester. Oh, finding a pediatrician and just, preparing for delivery and maybe looking into birth support with a doula, or if that's not your thing, then, childbirth education classes. And in the third trimester, just continuing all those things. But like if I could like once a month bring in
amazing.
like a person to give a little topic, have a lactation consultant come in, have a doula come in, have a physical therapist come in. Like in my perfect world, that's how prenatal care would work.
That'd be amazing.
And then you would still have your individualized visit for the things that you don't want to talk about in a whole huge group.
Right.
But
I love this vision.
in a perfect world, that's how I would design prenatal care. And maybe that is how prenatal care is done in other countries. I don't know, because I'm very, U.S. centric. I don't really know a lot about medicine in other countries because I've never practiced in it. Right. But that's my vision, like the village. Bring back the village, right?
I love that. Because I would say too, especially for first time moms who you don't know what you don't know, and maybe they don't have maybe their mom passed away, and they don't have a lot of aunts, or they don't have women, older women support to kind of get that info from. That would be amazing. We're going to make it happen. I like it. I like your vision. And I think that's listen, at the end of the day, us women have to stick together, and banding together to, share that knowledge.
We'll take care of our health.
Right. Yep. For those coming after us. I'm not having any kids, so.
Are there any things that you would tell women in terms of things to look out for in their life, precursors or suggestions you have?
Oh boy, that's
right. It's a loaded question, I'm sure. I mean, I guess obviously for women, what is it recommended now every 2 years to check up with your OB-GYN?
It's still a yearly exam.
Okay. But would you recommend, obviously, don't stop that?
I wouldn't stop that. The pap smear recommendations have changed, though, so they don't have to be done every year.
Oh, okay, that's what it was, a change.
Yeah.
But still yearly, they want you to check in, but the pap smears, that's what it was. It doesn't have to be done yearly.
Because the pap smear is really just checking your cervix, but you still have other gynecologic organs. We don't think about it, but your vagina, your vulva, your labia, that's all still things that we look at. I know some OB-GYNs who are like, I caught a melanoma on a pelvic exam once.
Really?
Yeah, because think about it, but it could happen. Yeah. Or just even things that aren't cancer, but, like lichen sclerosis is a really uncomfortable condition with, dry skin and patchy skin. And so those things can be addressed at an annual exam too. Yeah. And then the breast exam too. Yeah. Although sometimes I rant and rave about how OB-GYNs got stuck with breast because we don't really if I find a lump, I'm not operating on it. I'm sending you to a breast surgeon because they are the experts. But we still do a breast exam. And so how many times have I been you need
have
to
you?
get
Yeah.
Wow. Have you felt this? I thought it went away. I'm like, no, it's still there.
Yeah.
Yeah. So those things are important to check in on every year.
I'm a big advocate, I feel for going to see your doctor.
Yes.
Yeah.
Preventative.
Yes.
Yeah.
I know some people are like, I feel good, so I'm going to go 5 years, and I'll go when I don't feel good. But I don't know. I feel like you should go.
Yeah. That's women's health is definitely something that I think you should never put on the back burner because things can change in a year. Yeah. Right?
A lot. Yeah.
Yeah.
And don't wait until you're really not feeling good to be like, this has been happening for a while. And
No, it's crazy.
So some of women's healthcare is just regular old healthcare. So a lot of times women would come to me and they'll be like, oh, can I use you as a primary care doctor? And I'm like, thank you. But I don't know. I don't keep up to date with the recommendations on how often I should be screening for cholesterol and thyroid and all those other things. So I'm like, please get a real primary care doctor. Not that I'm not real doctor.
But I mean,
somebody who's specially trained in primary care and then I'll take care of the specialized parts. Yeah. So
but they feel comfortable with you. That's awesome. They were like, can you just be my doctor for everything?
That's always so. The biggest compliments that I've ever gotten as a doctor are actually the phrase that I hear that just makes me feel so proud of what I do is when somebody's like, I trust you.
Oh, definitely.
Think about as a patient, what you need to feel to say that to somebody.
Yeah. Right.
And then so I know when somebody's just like, whatever you think, Dr. Chang, I trust you. I'm like, Okay, but let me tell you risks and benefits of all the options, and I'll tell you what I think is right. But like, let me give you your 3
And
options.
do they say sometimes like, what would you do?
They ask me what would I do, or they would be like, what would you tell your mom? What would you tell your sister?
Yeah.
I went to a dental surgeon once, an oral surgeon, because I thought I had to get I still have my wisdom teeth at age 43. And so he did all these x-rays, he did the exam, and he looks at me and he goes, if I wanted to make money, I'd pull your wisdom teeth right now. If you were my sister, I'd tell you no.
Wow, that's
And I was
awesome.
Can we get more of that?
yeah. No, he was great. And then I heard he left the practice.
No.
So mad.
Where did you go?
I mean, hopefully I won't need an oral surgeon soon.
That's
but
awesome.
but I thought like that was so great. Like,
Integrity.
He's like, yeah, if I wanted to make money, I'd just pull them right now. But if you were my sister, I'd tell you no.
You don't need
do
to.
it.
Yeah.
And that's what I meant by like, I don't know. I feel like we need more.
I
of
guess
that,
integrity.
right?
Yeah.
Like,
Yeah.
Yeah, for sure.
I have to believe that most doctors are trying to do exactly that.
And I think insurance, like you said, insurance companies are not making it easy for
No,
them either.
I know.
And you're putting in all this work, and you're not getting the proper
I
compensation.
will say, there's a lot of burnout in medicine.
Oh gosh, I couldn't imagine how
a
there wouldn't
lot.
be. Yeah.
And you see it, I'm sure.
And I see it in, it's subtle, but then when you work with somebody for a long time, some of the nurses at the hospital, I'm just like, are you okay? Like,
Oh,
do you need some time off? But there's no,
yeah.
so hard.
it's hard to,
That's a tough job.
yeah.
Like, I respect the medical profession because that's hard.
but and our stakes are higher. Like,
Yes.
there's stressors in every job, but
Our somebody's life.
Yeah.
our
Yeah.
stakes are a little
That's
higher.
I commend you because it's a level of stress that I don't.
Right.
I personally
Yeah.
would never be able to handle.
You'd be surprised. But
Do you love delivering babies?
I do. I love delivering.
That's got to be cool,
babies.
right?
It's the best thing ever.
Yeah.
I always tell people like the day that it stops amazing you as being the most incredible thing that's happened is the day you have to stop doing obstetrics.
Yeah.
But like it's amazing,
It
right?
still amazes you.
It still amazes me to this day because you have a woman and her partner and you're there and you're looking forward to this new life coming into the and like literally there's a whole new person inside
so-
the room.
So weird.
And you
right?
look at this tiny thing and you're like,
Wow.
you have like all this potential in
Yeah.
you.
Yeah.
Like, who are you going to be when you grow up? And then you put baby right on mommy's chest and let them cuddle and everything. And you look and you're like,
So
That was the
cool.
most incredible
Magical.
feeling.
Yeah.
Like when they. When
I love that
know.
they do that
And
now, the
they're
skin to
like,
skin.
"Poor you,"
Yeah.
and you look at them on your belly and you're like, how did you fit?
Uh-huh. Yeah, where did you?
There?
Must have been very uncomfortable.
Where did all my organs go for you to fit in there? And like, now you look at your kids, right? And mine are 4 and 6, and I look at them and I'm, who made you this person?
It's still like mind blowing.
And I look at old baby pictures and I look at myself. I'm like, this is not the same person.
Yes,
Like,
it's so hard. Like your children, if they expressed, well, maybe not the 4-year-old, but your 6-year-old, they know you're a doctor. Have they expressed that they want to be a doctor? Would you be supportive of that?
I would be supportive. Yeah, I would be supportive. I don't know what medicine's going to look like in 20 years, so it could be totally different. My son, when I was in private practice, and it took a lot out of me, and I didn't realize how much I was expressing that at home. But one day my son was like, "Mommy, I'm going to be a doctor so I can go to the office and help you because you say you always need help in the office. So I'm going to come in."
What
and
a
help
sweetheart.
you." I'm like,
So cute.
it was sweet, but then at the same time, I was like, "Ooh,
Eye-opening. Yeah.
Time for a change.
things are bleeding and." Between
can sense it,
worlds.
yeah.
Yeah. And so, he also wants to join the army. He also wants to be a rock star.
My son also wants to join the army, so maybe they'll go together.
Yeah, that's weird. The army.
That's so bizarre.
Yeah.
Like just the army, not the Marines. Like
Army.
where did that even come from?
I think it's because I'm a big BTS fan and they all just enlisted in the military.
Really?
Korea has like mandatory conscription for men.
The pop star get that BTS. Yeah.
So we were talking about it at home, and I think he was like,
overheard.
And I want to do that.
yeah, I should go to the army. And then he also wants to be a rock star.
That's
he
so
wants
cool.
to be a policeman.
all the things.
So all the things.
Yeah.
Yeah. And my daughter just wants to be a princess.
As she should be.
Yes.
Yeah. She already is the princess of the household.
Yeah.
But she has to remember I'm the queen.
Yes.
That's right.
Mama is the
First came the queen. Okay, honey.
Right. I love it.
When I abdicate, then she'll be
I love that.
That's great. Well, do you have anything else you want to share with us while we have you here?
Oh, gosh. Everybody take care of yourselves.
Yes.
You
there
know,
you go.
preventative care is, what an ounce of prevention is a pound of cure. Is that what they say?
I like that.
Just, we're all trying to do the best that we can in this crazy world. It's 2024. Can't believe it.
Yeah.
But just be kind to yourself and take care of yourself.
I love that.
And also, if you don't jive with your doctor, you don't jive with your doctor.
And that's okay.
Find a different one.
Yeah. I like that.
I really don't. Sometimes, Sometimes I have patients who, when I was in private practice, they come into the office and I felt like all we ever did was fight. Not like fight.
Right.
But they questioned everything.
Contentious.
Every
Not a good
interaction was a little bit
Contentious.
Like it was me versus them instead of us versus
Yeah.
the problem. And I remember one time I had a patient and I was just like, we always fight. Like, why are we always fighting?
Yeah.
And she was like, we are? And she was like, no, I'm not fighting with you. I think this is just how I am. I'm like, oh, okay. But, if you find that you're always fighting with your doctor and you leave your visits not satisfied,
Or questioning it more.
what? We're not offended.
Right.
Yeah.
You can find a whole lot,
Right.
my personality doesn't drive. Some people, I like to joke around a lot. I use humor a lot to diffuse tense situations. I had a patient who just did not like that. She was like, this is very serious. Oh. Can you be more serious? I was like, oh, sorry.
I like the humor.
Yeah. And so she didn't jive with me. So
And that's okay. It
she
happens.
didn't stay my patient for very long. And that's totally fine. And
Yeah.
so, but, the ones who like a little humor.
Yeah.
You would be my doctor then. The uptight ones, I'm like, I just feel uncomfortable talking to you, being honest with you. But I want the doctor who kind of jokes me so I can just be honest with you and we can,
Yeah. Lighthearted.
Lighten the load of the air. Right.
But yeah, my parting words would be just be kind to yourself. Because sometimes I feel like I'm not very kind to myself. So
Yeah.
Why do we give ourselves a hard time as women?
Why? No. We do.
We were wired this way for some reason. We gotta change the wiring. And I
Yeah.
think the more we talk to ourselves, right, and the more we say, "Be kind, be grace," give us grace. We'll rewire.
But if you ever heard anybody talk about one of your friends the same way you talk about yourself, wouldn't you be really mad at that person?
Yeah.
Like, who the fuck are you talking to?
Yeah.
Like, beat your ass. That's my friend.
So why do we talk about ourselves like that if we wouldn't accept it for our best friend? Like we should be our own best friend.
Yeah. I love that.
Yeah.
Yeah. So, and I think one of the things that I've learned from being a doctor, I talk to a lot of people. I see people from all different walks of life. Everybody is fighting a battle.
Yep.
Everybody has, and the life stressors all come down to the same things. We want to be good people. We want to be good parents. We want to take pride in our jobs. Everybody is fighting that battle. And I think the sooner we all learn that about each other and understand that about each other, then
We're all more alike than dislike, right?
Yeah.
right.
Definitely.
But then we'll all have world peace.
Yeah.
Oh, I love that.
No, but yeah, like empathy.
Yes.
Empathy.
Yeah.
Goes a long way. Yeah.
Right. But we're all
Joanne for president.
Yeah.
no, thank you. No, that is
You're like, that's a job I don't want.
that is no. But yeah,
Or the general surgeon, right? I'm not even sure what they do, but something I would love for you to be like the director of women's health in the future.
I know. I
Right.
love these ideas.
Yes.
I love that you care.
right now I'm enjoying the compartmentalization of my life. Right.
Yeah.
Maybe when your kids are older,
Right.
right?
Right.
Yeah. That's great.
But I think the world needs more of you. So thank you.
I think the world needs more all of us.
Yeah.
I love it.
But
Well,
thanks.
thank you so much. Thank you for making the time. I know you're very busy. And yeah.
And I still have imposter syndrome.
Well, listen to
Well,
the
don't.
episode.
It's good to know that we're all human, right?
Yeah.
Even a doctor can go through it. We all do. We're all more alike than we are dislike. So I love that.
Yeah. Thank you.
Thanks for having me, Sean.
Thank you all
Happy
for
belated
listening.
birthday.
Thank you.
We'll see you guys next week.